A very good evening to all the viewers. My name is Richa and I welcome you all to We Talk Do You Show, a show by Puberty to Menopause, a public health awareness initiative by Human Biologicals Institute. Human Biologicals Institute, a division of Indian Immunologicals Limited, shaping global healthcare by spearheading the One Health Initiative. So, the One Health Initiative talks about optimum health of animal, people, and the environment. IIL was established by the National Dairy Development Board NDDB in 1982 as its unit and later registered as a company in 1999 with the name Indian Immunologicals Limited. Human Biologicals Institute was established in the year 1998 when the Government of India requested IIL to produce a modern tissue culture anti-rabies vaccine to phase out the unsafe nerve tissue vaccine. The first manufacturing facility of Human Biologicals Institute was established at Ooty. The facility is one of its kind in India to have rolled out the first varicella culture rabies vaccine in 2000. Subsequently, Human Biologicals Institute launched other vaccines and currently we are the major player in human vaccines. Leader in anti-rabies vaccine segment and present in around 50 countries. Three state-of-the-art manufacturing facilities at Ooty, Gachibowli and Karkapatla, also known as Genome Valley. Human Biologicals Institute has forayed into the market of clinically proven wellness products and infertility range of hormones. Coming to our vision, mission, and values. Our vision is shaping global healthcare by spearheading the One Health initiative. Our mission is to innovate, produce, and market quality healthcare products and services to improve and extend the lives. While coming to our values, we believe in providing affordable products with high quality through continuous technical innovations and improvements to meet our customers' need. As we know, we are a kind of company who will definitely look after taking care of environment as well. We proudly bring before you the Green Initiative as we have launched our flagship brand anti-rabies vaccine Abhairab in an eco-friendly pack. And with this, we could reduce 160 tons of plastic per annum. Now, as a company, we don't just manufacture and market products, but Human Biologicals Institute has done a lot in the corporate social responsibility and have taken up various projects. One such project is adoption of government schools. We have adopted two government schools in Karkapatla facility and totally revamped the facility and given private infrastructure to these government schools. And with our intervention, the strength of these two schools have been doubled. Our other program is Gift Milk Program. In coordination with NDDB, we are giving additional nutrition supplement to over 1600 school going children of Telangana and Tamil Nadu. And as we know, we are into field of rabies. We have tied up with FIAPO, Federation of Indian Animal Protection Organization, to make Thiruvananthapuram rabies free. You can visit our website www.indimmune.com. Our toll-free number is 1-800-313-999977. You can follow us on LinkedIn, YouTube, Facebook, Insta, and Twitter. You can also visit us at www.fearlessagainstrabies.com and www.pubertytomenopause.com. And today we welcome Dr. Smita Kore, who has joined with us today for our live session. And she will be talking on a very special and interesting topic, a very useful topic, that is role of antioxidants in managing infertility. Dr. Smita, with your permission, I would like to introduce you to our viewers.
Thank you, Richa. You can carry forward.
Thank you, ma'am. Dr. Smita Kore. Dr. Smita Kore is based at Hyderabad. She is an IVF specialist with over 19 years of experience. She is head and she is handling Smita Fertility Center for now. Welcome, Dr. Smita. We
Thank
wholeheartedly welcome you, ma'am.
Thank you for your kind introduction. And today I'll be talking on the topic of antioxidants. What are these antioxidants and how these are useful in the IVF and other infertility treatments? We will have a small talk on this topic, Richa.
Yes. Dr. Smita, for the benefit of our viewers, I would say we will start on with what are antioxidants and what are free radicals and can you just elaborate on it, Dr. Fur?
Yeah. These free radicals are the substances generated because of the oxidation reactions in our body. Especially these are hydroxyl radicals and superoxide radicals will be there. These bind to the structures in the ovum or sperms, and they will generate these reactive oxygen species which are very harmful to the sperm and ovum and for the implantation and for the pregnancy and miscarriages. And these reactive oxygen species have to be are normal in our body, but when they are in the excessive levels, these have to be supplemented by antioxidants so that they are neutralized and there won't be any damage to the sperms and oocytes. These are mainly secreted in all the body parts, and especially when there is like stress, lifestyle factors like obesity, smoking, alcohol, and all these factors will aggravate these reactive oxygen species in our body, and they will affect the fertility of the women and males, especially smoking, alcohol. These are all the lifestyle factors which we have to modify to reduce the reactive oxygen species which are generated in our body. For that reactive oxygen species to be neutralized, we give antioxidants to neutralize the reactive oxygen species. These are normally found in our food items, but which are not sufficient for the neutralization of these reactive oxygen species or ROS. So we have to supplement externally in the tablet form, and also add dietary supplements to these women and men so that they can have like treatment, a good success rate of their treatment.
Thank you so much, Dr. Smita. So, Doctor, going forward, then how does antioxidants actually help in enhancing, the infertility treatment outcomes? And can you just elaborate somewhat on this as well and the benefits of it for the infertility treatment?
These antioxidants are used separately for women and men. For women, these antioxidants increase the oocyte quality, and implantation rate will be increased, and the fertilization rate also will be increased by the usage of these antioxidants. And in the male part, these antioxidants will increase the sperm count, sperm motility, morphology, and also they will take over the leukocytospermia which is there in the male sperms. When we see the semen analysis, we'll find whenever the leukocytes are more, these all will be tackled by these antioxidants, so that the patients who are having asthenospermia, where the motility is low, they can have the increase in the motility, and oligospermia, where the count is low, the count can be increased. And in the morphology also, we can increase the morphology by using these antioxidants. And for the females, like as I have said now, it will increase the oocyte quality number, and also in the cytoplasm of the oocyte, this will increase the mitochondrial ROS will be decreased, and cytosol and cytoplasm vacuoles and everything will be neutralized by these antioxidants in the oocyte, and they will help in the motility of the embryo into the uterus and have good implantation rates and good placentation with increased blood circulation, thereby decreasing the abortion rate, preterm deliveries, and preeclampsias in the future after the confirmation of the pregnancy. The,
Yes, Dr. Smita.
these are used both in the men and female, and these are to be started like before planning the pregnancy and have to be continued throughout the pregnancy. till the so that the baby won't be having intrauterine growth retardation and other complications like oligohydramnios, where there is decrease in the weight of the baby and also in the amniotic fluid of the baby. These antioxidants will be useful.
Uh, right, Dr. Smita. Doctor, additional treatment with the micronutrients and as antioxidants, starting 3 months before the IVF cycle, it protects the follicular microenvironment from oxidative stress as well. So, thus they increase the number of good quality of oocytes. So, Doctor, how can you explain this in a easy way so that our viewers can understand better that what is the quality of oocyte, what is an oocyte, and how does antioxidant, help in making a better oocyte?
Oocyte is like a normal egg in the female, which is very essential for the development of the fetus, and it has got the oocyte, which has got nucleus and cytoplasm surrounded by granulosa cells. These are all very important, and this microenvironment of the oocyte is very essential. And the oocyte contains an antrum which is filled with the follicular fluid, and this follicular fluid supports the oocytes and gives the nutrients to the oocyte for the development during its development. And this follicular fluid is very important because these antioxidants will act in the follicular fluid and support the nutrients which are required for the oocyte. And during the process of the development of the oocyte, in its stages from the follicular rupture to the implantation, fertilization, and implantation, these antioxidants play a very major role in the oocytes. And we have to start these micronutrients at least 3 months before we are planning the pregnancy, because like folic acid, which is benign vitamin, it has to be started at least 3 months when we are planning the pregnancy. This will prevent the formation of neural tube defects like spina bifida. The brain and the spinal cord will be protected when the embryo is formed. That is why we have to start folic acid with 5 mg before conception. And the body levels of most of the patients have low levels of homocysteine, metabolism abnormalities. Then also this folic acid has to be supplemented. And other vitamins like B12 also we have to supplement. Vitamin E, D, these are also very essential, and we have to use prior to the conception, prior to the planning of pregnancy. Iodine also we have to supplement in the form of potassium iodide, like iodized salt. If you take it preconceptionally, then after the formation of the embryo, the miscarriage rate will be very less. And in the further milestone development of the baby, the intellectual capacity will be more when we add iodine supplements preconceptionally itself. And along this we can take selenium, zinc, glutathione. These are all has to be taken preconceptionally so that the formation of the embryo will be good. Along with the oocyte, the formation of the embryo is also very good in these patients, where the complication rates will be very low, miscarriages rates are also very low. The implantation and ongoing pregnancy rate also will be very good with the supplementation of these micronutrients.
Uh, right, Dr. Smita. So, Dr. Smita, like in women, antioxidants play a major role in formation of a good quality of oocyte. Similarly, Doctor, when we talk about males, so antioxidants play a vital role in enhancing even the count of spermatozoans. So, what are your views on it, Doctor? So, if you can explain to our couples who are actually going through this journey of infertility, so infertility treatment. So, what are your suggestions for the male counterpart as well?
For males, these antioxidants will increase the sperm count, motility, morphology, and also tackle with the infections in the semen. Most of the times we use antioxidants like astaxanthin, lycopene, uh, beta carotene, and ubiquinone. These are all used in the male infertility, especially for increasing the count and motility. These also have to be started like 3 months before planning for pregnancy, because these all medicines will take time until the spermatogenesis process, which takes around 90 days to finish. That has to be completed for these medicines to be effective. Till that time, the count and motility will be in the same range, and after that, we will see the gradual improvement in the motility, morphology, and count also. These act on the mitochondria of the sperm, which is the powerhouse of the cell, and also they will act on the DNA and chromatin of the sperm, and they will increase the capacitation, acrosome reaction, and sperm oocyte fusion also will be more with this use of antioxidants in males also. Then, along with the antibiotics, if we add antioxidants, the infections which are there in the prostate or seminal vesicles will be cured along with the epididymitis, and then gradually these ROS will start decreasing. Then we'll have the normal parameters of this semen analysis. We can supplement them with the food items also, along with the antioxidants which contain more of the antioxidants. We can suggest them the food additives also.
Okay. Uh, Dr. Smita, does the addition of melatonin to any of the antioxidant preparation, does it help, in enhancing the quality of antioxidant or enhancing, I would say, the efficacy of antioxidants?
Yes, yes, definitely, Richa, because this melatonin is like a hormone secreted by the pineal gland, which is it helps in reproductive function and also in the sleeping pattern of the individual. This will be like imbalance in those people who are doing night shift, because this will be started secreting in the night time, and it reaches in the midnight. And those who are working in the night shift, these hormonal imbalance will be there, and this hormone along with the other antioxidants enhances the reproductive capacity, and the oocyte will have the better quality of oocyte will be produced. But when they, because of the night shifts, when there is a lack of circadian rhythm, these people will have imbalance of these melatonin hormone, and this hormone is an excellent antioxidant when supplemented along with the other antioxidants, so that we can have good quality of oocyte. It is available in the medication part, we can supplement it. It is like not a sleeping medicine which will increase the sleeping pattern of a person, or neither it is addictive. We can use this melatonin, which is along with the other antioxidants, it's very good for the formation of the oocyte quality and the micro environment of the follicle. Richa?
Yes. So, Dr. Smita, do you suggest the couples who are going for IVF treatment that they should ask, they can ask by themselves also to the doctor for antioxidant supplements? Is it recommended that way?
Yes, they can ask. Meanwhile, they should also take the antioxidant rich food like fish, nuts, and cod liver oil, and also these green leafy vegetables which contain folate. And they can take poultry like skimmed milk and eggs also. Along with that, they can ask the doctor to supplement them, and a few investigations are required for vitamin D levels, which is very essential nowadays. Everyone is facing the problem with vitamin D deficiency. We can supplement vitamin D, vitamin E, and also the other nutrients in a dose which is not excessive, which is required as per the patient's requirement. We can adjust the dose and give it to the uh, patients like before itself. If they ask, we can supplement in depending upon the investigations report also. Even if they don't ask, we have to supplement them.
Right. Thank you so much, Dr. Smita, for so nicely and elaboratively explaining to our viewers about role of antioxidants, in how it can help in managing infertility in men as well as in women. So, ma'am, as a concluding, I would say, what are the major points you would like to tell to our viewers and any suggestions for the IVF couples? Because they come in a very different situation to IVF specialists. So, a lot of mental preparedness is also essential. They have to be, they have to relieve their stress as well, which is one of the major, agent of releasing free radicals. So, in conclusion, ma'am, what would you like to suggest?
I suggest, along with the antioxidant intake, they should change their lifestyle and reduce the stress. And if they are obese, they have to reduce their weight. If they are very thin, they have to gain the weight and reduce or completely stop smoking, alcohol, caffeine intake, and like junk foods and all. They should be reduced. Sugars also should be reduced. These are all the lifestyle changes we have to start, along with the intake of the antioxidants. And this stress which they are going through in the treatment, in the process of treatment for IVF or any other treatment, this stress also increases these reactive oxygen species, and therefore it is very essential to supplement everyone with antioxidants before starting the IVF treatment. And let each and every patient ask their doctor for a antioxidant supplementation if they are aware of this, and they can proceed with the treatment without any stress. Then the ROS will be less, and the antioxidant mechanism will be good when considering their oocyte and sperm quality.
Thank you so much, Dr. Smita. Ma'am, we have few questions in our chat box, and few of the questions personally have also come to me. I would like to just ask you. Doctor, one of our viewer is asking, should every couple consume antioxidants during preconception phase? If yes, for how long?
At least 3 months before preconception, these antioxidants have to be started, and they have to be continued almost like 34 weeks of pregnancy, so that they will have less complications during their pregnancy and also before implantation. And these like folic acid we will continue, and vitamin D, vitamin E. These are all they should have to consume preconceptionally, and after conception they have to continue with the iron, calcium, and also this calcium which is useful along with the vitamin D supplementation. We have to continue throughout the pregnancy to decrease the complications like PIH, preeclampsia, gestational diabetes, low birth weight, premature rupture of membranes. All these complications will be reduced when we supplement during the pregnancy also.
Okay, ma'am. Another question is there. What can we do for not having good quality of egg? Maybe she might be going through the IVF treatment and she might have heard this word, ma'am. So if you
Yes.
can suggest.
Yes. The quality of the egg, this can be improved along when we use the antioxidants from the before 3 months, going for the pickup or like going for the treatment. Then only the quality of the oocyte will be increased. Along with the antioxidants, we can supplement with this DHEA, dihydroxyepiandrosterone. This is also supplemented 3 months before to increase the oocyte quality. This is like 75 mg dosage per day, and this DHEA should not be used during when we are starting the treatment. It has to be stopped when we start the treatment. Before only we have to use this to improve the oocyte quality.
So, doctor, one more query is there. Uh, can you suggest few good antioxidant tablets as we are going through the IVF treatment, but our doctor has not suggested us to take till now?
Like there are so many companies, like I'll tell to take vitamin D, vitamin E, folic acid, and B6, and selenium, zinc, iron, calcium supplementation. These all you can take, and also with good amount of carrot, beetroot, dates, nuts. These are all will increase in your. If you increase in your food, it will be better. These are like also are there. You can take from them, but the
Uh,
dosage should be in the appropriate manner. Better consult your doctor and ask them, like we have heard about antioxidants, ma'am. Can you supplement? Then most of the doctors will be willing to write the prescription.
yes, so you are suggesting, doctor, that it's always better to take, opinion from your own IVF specialist rather than consuming anything on your own.
Yes,
So,
yes, they know what is deficit in your body, and
yes.
they know how your BMI is, and how your lifestyle is there, what are all other complications you are having, like diabetes or hypertension. Depending on all those factors and depending upon your age, your husband's sperm parameters, and his BMI, his medical conditions, depending on all those factors, they will suggest for both of you.
Thank you so much, Dr. Smita, for giving your valuable time to us, ma'am, and coming here for our show, We Talk to You. We wholeheartedly thank you, ma'am.
Thank you, Richa, for giving me an opportunity. Thank you, Human Biological Institutes. Thank you, everyone from the audience who have shared their queries. Thank you, Richa.
Thank you, ma'am. And also, once again, on behalf of Puberty to Menopause, a Women Health Awareness Initiative by Human Biologicals Institute, I wholeheartedly thank to all my viewers as well who are constantly watching our shows on different topics. We request all of you to visit www.pubertytomenopause.com for more information on various health aspects of women at different stages of life. And follow us on Facebook, Twitter, Insta to get more updates on health and live talks with expert doctors across the nation. Till then, choose better health and choose wisely your food habits, lifestyle, and all these things. Thank you so much.